Well, greetings again. This is Dr. Bill Wyatt, and I'm going to talk some of you this morning about palatal separation. And this is a very important thing for pediatric dentists and any dentist working on children ought to know how to do palatal separation. And now we have developed a method of opening the sutures, and we're able to do that up into the early 40s on a lot of people, and that's something that where you open the airway. Now, what happens? People have allergies and things that they can't breathe properly, so they breathe through their mouth, and their tongue stays in the bottom arch, and the palate just doesn't develop like it should because the tongue's not in there pushing it out. And then, so we found out that children nursing ought to nurse for a long time, maybe 2.5 years, something that helps develop the maxilla, because they can't nurse and breathe through their mouth. And this is kids breathing through their mouths causes the palate not to form properly up here. And so you have to go in and open this up and put that over. Let me get this started right here now, and I'll show you this young lady right here has a little extra vertical height of the face because she's a mouth breather, and that doesn't develop this maxilla up here. The tongue is down in this part of the mouth, and it'll spread it out a little more than normal. And you notice the upper arch is sitting right on the edge, right in here and on this side. And so we're going in here to try to widen this arch out and develop that. And that'll also, while we have the palatal separator in there, forces the tongue down here to widen the lower arch to go along with it. So that we widen this out. And the palatal separator, we can go in on deciduous teeth, band those deciduous teeth like that, and make the palatal separator while they're still in the mixed dentition. That's when it opens best. And you can do this so up until people in their 30s and some of them in their 40s. We can still open it by putting spring between the upper teeth up here and pushing it apart, as well as being pushed apart down here in the back part of the mouth. All right, here is the cephalometric picture, and this was and she's 9 and 3 months old, and this was in 1987, and we've been showing these things for years, and we get people to do this. We feel like that dentists, especially those that work on children, pediatric dentists, ought to be able to put palatal separators in and work with their children like that. So here we are, the self in the way it is. All right, we go in and line the teeth up and get them pretty good, and you got some deciduous teeth, and we wanted to lower the vertical on it, so we had bands on the deciduous teeth and put this in, cemented it, and put this acrylic blocks in here. This makes the person bite harder. You know, you do this with soft acrylic, or you have a very hard time getting it off. And you do it soft acrylic, you cut a groove in it to take it off and pinch it from the sides, and it will break loose like that, and then you can take the thing out like that. All right, there is a palatal separator with the bonded blocks under it. So when you put those two like that, you got space in here, and so we're going to look on this and bring these teeth down with a little flexible wire. While we're doing this, we've got the wire going through here, but it has little effect on the teeth we have banded. Now we take this off. That's the palatal separator there again. Now we remove that, we crack that apart, Let's show it, keep showing the separation. There, now we've got this over and we line the teeth up and we go for a round arch wire up above. Down here we're opening a gap to bring something in, and we'll have a larger arch wire here that has little brackets we use there that helps rotate the teeth. There we've got the palate now separated and expanded out. We cut the separator off and leave these teeth back in here. We had these deciduous teeth banded, and it moves the teeth before the permanent teeth move. As you move the deciduous tooth, it moves it out like that. Now let's see, this is 1912 of 91, looks like there. All right, we widen this out and we bring the space together. And you take this person that had this problem to start with, and you widen this out and you give them a lot more breathing space in here. Now she was age 9, 3 when we started, and this is a cuspid tooth coming in here, and you've got to get these 3 permanent teeth in this gap right here. These are deciduous teeth, and these 3 teeth are coming in here, and we're doing this. As these erupt up, you see they're eating the roots of the baby teeth away, and they're coming into this position. This is a wisdom tooth. Here's a wisdom tooth over here. We don't need the wisdom teeth right now. We wait and see how much the person is going to grow, and sometimes people will lose this tooth here, and we'll take this one and the wisdom tooth and fill that gap in. That's something else we want to talk about, is replacing 6-year molars that young kids, when they get them, might not be able to take care of them properly. So you can, if you lose it, you can bring the 2nd and the 3rd molar up into place. We'll show that on another video. All right, here's the palatal separator, and we have bands around all these teeth, and this is cemented so that it can. Now these separators that are just a bar in here don't work right. They'll carry the roots of the one where they've got the band around the tooth out, but you need to band the teeth and everything moves out like this. Don't just push them out and the teeth do more or less this way. You need to open this up. As you open this up, this increases the airway up above and gives you more airway space. Now it looks like these wisdom teeth won't have room to come in. I don't know. And we wait till this young lady matures, and if she doesn't have room to get the wisdom teeth in, you better have them removed. All right, so we did do that. We had these wisdom teeth taken out. They didn't have any room at all back in here. And I think they got the upper ones too. And here we still didn't get enough vertical height down. We would like to lower this where the chin was just about the same distance from here, here to here, and here. But this is a little excess vertical height of the face, and it is increased there, and we didn't get that closed down as much as I would like. But we've got the teeth lined up real good, and everything separated, and this is something we need to learn. That's a distorted picture over here. And here is the young lady when we started. And this is the way the teeth were when we got going. Now we're going to try to reduce some of these and get them in some articles so you can see it. So we'll take some of these pictures out. We just straightened that out with a flexible wire in here. And I'm sorry for that picture. Now we'll come in here and we'll put this palatal separator in. And here the separator is, and there it is. Then we take the teeth out. We've got a little reduction. This is not too much down here in the height, because here it's getting pretty close to what we would want it. So thank you for watching, and I hope you learn how to separate the palate. And if you're a pediatric dentist, you ought to be doing this type of work. And I just feel strongly about that. And if you're a dentist anywhere and you work on kids or young people, or even as you get adults, you could do palatal separation. Changes the whole life of that person, bringing their palate out where they breathe through their nose better than breathing through the mouth. Thank you for watching, and I'm going to sign out.